consultant at Milan Fertility Center, Chandigarh. So today we will be talking to you about should a couple try again if she's had a failed IVF cycle prior. Now we all understand that a failed IVF cycle is a very distressing and a daunting task for a couple, and ours being a tertiary IVF center, we commonly come across patients who've had one or multiple failed IVF cycles, and we help turn their hope into happiness. Now, before starting, I'd like to mention here that the global IVF success rate is in the tune of 30 to 35%. However, if a couple has undergone, say around 3 cycles, then the cumulative pregnancy rate in good prognosis patients does go as high as around 70 to 90%. So whenever a couple who's had a failed IVF cycle comes to us, we tell them that for a successful IVF, they need a good quality embryo, a receptive endometrium, and an appropriate crosstalk between the embryo and the endometrium for them to have a successful outcome. And if there's a defect at any of these levels, it can result in a failed IVF cycle. So basically, whenever a couple who's had a failed IVF cycle comes to us, we just don't jump into another IVF cycle. We rather delve into her history, have a look at her records, look at how the egg quality was, how was the embryo quality, how was the sperm quality, and how was her endometrial thickness in the previous cycle, and most importantly, where was the IVF cycle done, to have an idea about the culture and the lab conditions. So whenever a patient comes to us, what I personally prefer doing is doing a natural cycle monitoring before jumping into another IVF cycle, because a natural cycle monitoring will give us a lot of information about the patient. It will help us in finding out any cause which could lead to a failed IVF in the failed previous IVF. For example, there could be a polyp which was missed, maybe her endometrium was thin, or maybe there was fluid in the cavity, and we need to correct all of this by either hysteroscopy or laparoscopy before we go ahead with another IVF cycle. Also, we try doing things a little differently. For example, if she's had a failed day 3 transfer, we prefer doing a day 5 transfer this time, because the embryonic genome actually gets activated after day 3, and so we get to know a lot more about the embryo. Also, if she's had a fresh embryo transfer prior, we prefer doing a freeze-all cycle this time, because it provides a better milieu for the embryo to implant. If, however, she's had good quality blastocyst transferred in a frozen embryo cycle and that too hasn't worked out for her, then we offer her something known as pre-implantation genetic testing for her embryos, which help us in picking up good quality genetically normal embryos, thereby improving her success for an IVF cycle. Also, there's been a lot of advancements in the field of IVF. We've got advanced sperm selection techniques also, like INSEE, PIXI, and microfluidics, which is now coming up, which in turn help us in selecting a better quality sperm and thereby helping us in having better blastocysts, thereby improving the success rate of an IVF cycle. Also, we have things like time-lapse imaging. It is basically a camera which is put in the incubator, and so we do not have to take out the embryos again and again out for assessment, and it helps us to study the morphokinetics of the embryo much better, thereby giving us improved pregnancy outcomes. Also, artificial intelligence has come up in a big way in the field of IVF. We have something known as ERICA testing, which in fact looks at 20 parameters in the embryo, which the naked eye of the embryologist cannot look, and thereby, it helps us in selecting the embryo, and they say that with the use of ERICA or artificial intelligence in IVF, we can have a success rate of around 80 to 90%. Also, there's another category of patients who've had good quality, euploid embryos transferred, but still their IVF cycle doesn't succeed. So in that category of patients, we offer them something known as the ERA testing. It is basically a genetic testing of the uterine lining, which tests more than 200 genes and tells us exactly in hours as to what is the best time to put in the embryo. It usually is altered in around 10 to 20% of patients who've had a failed, who've had a previous implantation failure, and is really helpful in helping those category of patients. Also, we use a lot of empirical treatment in patients who've had a failed IVF cycle. We use immunomodulators, stem cells, basically other things which can help the embryo in sticking to the endometrium. So basically, I'd like to conclude here by saying that, with one failed IVF cycle, please do not lose hope, as there's a lot more that we can offer. Again, I'd like to mention that, a good embryology lab and a good in-house embryologist, it forms a backbone for any good IVF center. And we at Milan have an excellent team of embryologists which help us in, achieving our goals of turning your hope into happiness. Thank you so much for your patient listening.